If you're experiencing unbearable pain in your lower back, stomach, or side, or you're seeing blood, cloudy, or smelly urine, you might have a kidney stone. Kidney stones are hard collections of salt and minerals, often made up of calcium or uric acid. These stones usually form inside the kidney and can travel to other parts of the urinary tract, causing unbearable pain and discomfort. The most important thing is to know how to recognize a kidney stone symptom and how to treat it before it's too late. So in today's video, I'm going to reveal the most common kidney stone symptoms that indicate you have a problem and how to treat it naturally and effectively. Hey guys, Dr. Gus here, naturopath, acupuncturist, conventional doctor, and founder of drlandivar.com. In this channel is a conventional doctor treating patients through natural medicine before recurring to the use of pharmaceutical drugs. So if you're new to my channel, consider subscribing and press that bell down below to see notifications and be the first one to watch a new video. If you need to line an appointment of quality supplements for your disease, visit drlandivar.com, and I encourage you to stay till the end of this video where I'm going to review extra tips and video links related to this topic. Believe it or not, kidney stones are one of the most painful health conditions in existence. If you've never suffered from a kidney stone formation, you've never really seen what pain can do. Stones can vary in size. Some of them are tiny like a grain of salt, but others can grow to the size of a marble if left untreated. Kidney stones form when too much of a certain mineral in your body accumulates in your urinary tract. The most important thing is to do everything in your power to prevent these stones from forming and know how to recognize the symptoms once they show up before it's too late. So in today's video, I'm going to review the most common kidney stone symptoms that indicate you have a problem and how to treat it naturally and effectively. If at any point in this video you need a good quality formula that can help you do an excellent kidney cleanse and prevent or even help eliminate your kidney stones, look for Uriescence, D-Berry, and Magnesite from Fineland at drlandivar.com. I'm going to divide this video into two very important parts. First, we're going to analyze the symptoms of a kidney stone, and second, how to treat it naturally. Number one, lower back, stomach, or side pain. I don't know if you knew this, but kidney stone pain, also known as a renal colic, is one of the most severe types of pain imaginable. The only people that truly understand this are those who have experienced this health condition at some point in their lives. Some people who have experienced kidney stones compare this pain to childbirth and getting stabbed with a knife. You see, this happens when the stones move into a narrow part of your ureter. This blockage builds up pressure inside the kidney and activates nerve fibers that transmit pain signals to the brain. Now, the problem is if you're not taking good care of your health, a kidney stone pain often starts suddenly, and it gets worse as the stone moves downwards and changes location inside the urinary tract. This pain often comes and goes in waves, which makes it even worse because the ureters contract trying to push the stone out of the urinary system. Each wave of pain may last a few minutes, then disappear, and later during the day come back and cause pain again. You may feel the pain along the side of your back, below your ribs, etc., all over. It's excruciating. Number two, if you see blood in your urine, you might have a kidney stone. If you see a change in color in your urine, maybe red, pink, or brown, you might have a kidney stone. It's easy to get scared if you ever see blood, especially in your urine. And the truth is that seeing blood in urine is not something that, should be ignored. Let's not forget that this can be a symptom of kidney stones, but could also mean that there's a problem with kidney function, meaning there's a damage to this precious organ or even cancer. Now, blood in the urine is more of a common symptom in people with stones in the urinary tract. Blood can get red, pink, or brown in color, and sometimes even too small for us to see it without a microscope. This is actually why a doctor might want to take urine tests and send it to the laboratory. It's important to know how much blood is in the urine to be able to treat it appropriately. So now you know, if you see a change in color in your urine, maybe red, pink, or brown in color, you might have a kidney stone. Number three, if you feel a constant need to go to the bathroom, you might have a kidney stone. Now, pay close attention because needing to go to the bathroom more frequently or more urgently than normal is another very important sign that there's a stone that has moved into the lower part of your urinary tract. Now, this symptom is very important because needing to go to the bathroom is not only a sign of kidney stones. This can also be a sign of a urinary tract infection or a prostatitis. You see, inflammation in the lower part of the urinary tract can cause an urge to urinate, and this is why it's also not only a symptom of kidney stone, but other conditions as well. If this happens, you might find yourself running to the bathroom or needing to go constantly throughout the day and night. So be careful, because if you see this symptom, especially with the others I've just mentioned, you might have a kidney stones. Now, if you have your doubts, it's always best to visit the doctor and run some tests to know exactly where the problem lies and what it is. Number 4, if you're experiencing nausea and vomiting, you might have a kidney stone. Believe it or not, it's very common for people with kidney stones to experience nausea and vomiting. You see, this happens because there's a shared nerve connection between the kidneys and the GI tract. Having stones in the kidneys may trigger off nerves that have a strong connection with the GI tract. This sets off an upset stomach and later on causes nausea and vomiting. This connection is very interesting because it happens in other parts of the body as well. For example, having problems with the heart can manifest itself as jaw pain, and believe it or not, it's very, very common. This is why a symptom can have many meanings, and you have to understand the connection between nerves in order to make that a diagnostic. So now you know, if you're experiencing nausea and vomiting and you see any of the other symptoms I've just described, you might be experiencing kidney stones. Okay, now that we know how to recognize a kidney stone condition, let's reveal some of the most natural ways to treat and prevent them naturally. Number 1, start consuming magnesium. Magnesium is one of the most important minerals that plays a very important role in kidney stone formation and excretion. This mineral is involved in hundreds of metabolic reactions within the body: calcium balance, urinary balance, energy production, and even muscle contraction and movements. The best part is that now there's evidence that proves how magnesium may help prevent calcium oxalate kidney stone formation. You see, magnesium plays an extremely important role when it comes to balancing out calcium in our bodies. New scientific evidence has seen how consuming magnesium prevents you from losing calcium, and this in the long run helps prevent kidney stone formation in our urinary tracts. What I suggest you do is try to consume close to 400 milligrams of magnesium at night before you go to bed. This will help you prevent stone formation and in some cases even help eliminate them from the urinary tract. If you need a good quality magnesium supplement that contains 3 of the most effective magnesium types available in nature for this purpose and overall health, look for Magnezide from Fineland at drlandivar.com. Magnezide contains magnesium citrate, magnesium oxide, and magnesium aspartate. Number 3, drink plenty of fluids. When it comes to kidney stone prevention and excretion, drinking plenty of fluids is one of the most important things you should be doing. Water and fluid consumption dilutes the amount of stone-forming substances in urine and the urinary tract. This means that consuming lots of water and fluids makes you less likely to crystallize minerals that precipitate to form stones in the urinary tract and your kidneys. Now, one thing is important, and it's that not all fluids are equal. Water is one of the best to consume, and beverages like coffee and beer are 2 of the worst you should be avoiding. If you need a good quality supplement formula that can help you do an excellent kidney cleanse and prevent or even help eliminate your kidney stones, look for Uriessence from Fineland at drlandivar.com. And help out the channel by giving this video a thumbs up and sharing it with your friends and family. And if you have any questions, leave your comments down below and I'll be happy to assist you. If you need quality supplements for your disease or line an appointment, visit drlandivar.com. And I encourage you to check out these other videos related to this topic. You're going to find valuable information that might prevent a serious health condition in the future. Thanks for watching, you guys, and I'll see you soon.